Fitness influencer Joe Lindner has suffered a sudden death at the age of 30, and the cause of the death seems to be a rupture of the aneurysm. I am Dr. Harun Ilyas, and if you are into mechanics and anatomy of sports injuries, consider subscribing to this channel. So the news has recently gained hype as Joe Lindner's friend and his girlfriend has announced that Joe Lindner has suffered a sudden death due to a ruptured aneurysm, and in this video we will be talking about what could be the mechanics behind this kind of sudden death at such a young age of 30. So before I move on any further, let us have a look at what an aneurysm is. An aneurysm is basically a dilation of blood vessels which can occur in any portion of the body, and arteries are the more prominent blood vessels that are usually affected, and the main reason for the arteries to be involved on a much higher incidence than the veins is due to the lack of elasticity of the arteries. However, veins on the other hand possess some bit of elasticity so that they can stretch out, but so the more common arteries that are involved in this kind of aneurysms are the aorta, the femoral artery, the popliteal artery, and the cerebral arteries that are present in the brain, and any part of the rupture of the aneurysm that can result in a very fatal situation. So among all the aneurysm, abdominal aorta aneurysm are the most common, and after that there are thoracic aorta aneurysm. The aneurysms are basically an incidental finding in which the patient is usually being scanned for some other problem, and it suddenly appears on ultrasound, MRI or CT scan, and due to this reason there is a high probability that that aneurysm might get ruptured if it is not able to hold the blood on its own, and as there is a dilation of the layers of the artery, this can result in extra pressure on the artery wall, and it could result in the rupture of that particular part of the artery, and due to this there could be a massive leakage of the blood from that portion. So let us now discuss what could have caused this kind of aneurysm. So basically the risk factor involved in creating an aneurysms are the age would have to be over 60 years old, in which there could be weakening of the vessels wall, and when the blood arrives, when the blood collides on the wall, they are not able to maintain their position. Other risk factor could be smoking, hypertension, and few other problems such as viral or bacterial infections that can also put the patient, that can also put the person at the risk of creating an aneurysm. And another important risk factor for the aneurysm could be genetic, in lacking some of the elastin component of the aorta or the arteries that help in the stretching of these vessels. So this is it from this video. Thoughts and prayers for Joe Lindner's family.